You good?
Thanks everyone for joining. For those that aren't able to join live and are viewing this as a recorded session, welcome. First, want to thank Slava for putting this together. This is really the first webcast of this type that we're trying to see if this is of interest for folks in the Boston chapter of ABFO. So after this, we'd love to get your feedback. Please email Slava, myself, both of us, whatever works for you, with any feedback that you might want to share. As most of you ABFO chapter members are familiar with, we do put on these webcasts, and it's more kind of building skills, continuing education, and those types of topics that I think everyone is a lot more familiar with here. But in this instance, I'm excited that Slava was able to work with the Moffitt Cancer Center here, trying to provide an opportunity to learn about opportunities that companies might have and how we might be able to work with organizations like the Moffitt Cancer Center. And Slava, I'll turn it over to you from here to maybe introduce the team and take it from here. And I will go on mute, and I'm going to have to drop off at some point because I'll be boarding my plane here very shortly. But thanks again, everyone, for joining. And Slava, once again, great job putting this together. To listening.
Thanks, John. And I apologize for some of the quality. This is, we don't have a professional studios. We do it on the run. We do the best we can. So I appreciate some leeway from the audience on this recording. A couple of tactical or maybe administrative things is if for those who don't know me, Slava Birdman. John, who just spoke to us from the airport on his phone, is a chapter president. I help John with the membership and some event organization. So as John again mentioned, this is a new format for us for our online series. We are trying to experiment with different content, different formats. I start to get requests for also events organization on the different topics of interest. So if there's something in particular that you guys are interested in or would like to help organize, please reach out. From the chapter standpoint, this is obviously our first in the year Zoom event. We have our social event coming on the 27th, Thursday, February 27th. After this call, I will send a reminder for those who wants to register for that. And of course, don't forget the national conference for ABFO is coming in May in San Diego. We love the location. It's only second best to Boston. So we hope to bring big team out of Massachusetts into California. So without further ado, allow me to introduce Xavier, Avat, Jenn, Bonilla, Leo, Christmann, and Kamal Jethwani from Moffitt. Leo will be my partner in crime who will be driving the presentation from the Moffitt side. So Leo, please take it over.
Thank you. Thank you, Slava. So the first presentation is with our CBO, Xavier Avat. Xavier?
Thank you, Slava. Thank you, John, also for putting this together. We're glad to be the first group that you're testing your format with. I wanted to thank everyone also for your time and for joining us today to learn a little more about Moffitt. But as also Slava pointed, it's really an opportunity to get to know each other and see if there are opportunities for partnering. Because one common thread you're going to hear today from me and my team is that Moffitt is open for business, and we're really looking at ways to partner with the industry, and you're going to see how we're thinking about it, but also how we're structuring ourselves to make it happen. So the first slide is about partnering for Q, and this is really what we are all about at Moffitt, and what we hope today will lead to. If you can go back to a couple of slides, Leandro.
Yeah,
I'll let you know when we
yes.
want to move to the next one.
Just
one also little note that I hear that many of you are already in the Florida or Tampa, maybe even area. Today, it's going to be about 80 Fahrenheit. And so for those of you who are still in the Northeast, you're welcome to come visit us anytime here in Tampa. So the mission of Moffitt, well, sorry, maybe one more quick point. I know you had a slide about me, not that it matters much, but I joined Moffitt about a year and a half ago as a Chief Business Officer, and I'm really coming from the industry world. So I spent 30 years of my career in the for-profit world, working both on the biopharma, medical device, and diagnostic sides, pretty much throughout the country. A lot of these years in California, but also in the Midwest and in the New York area. So who is Moffitt? In fact, Moffitt is one of the top 3 oncology-focused institute in the country. And our mission is very simple and very clear. It is to contribute to the prevention and cure of cancer. So this is what drives us on a day-to-day basis. There are still way too many patients who die from cancer on an annual basis. And we really believe that we are approaching a time when we're going to change the course of cancer and engineer cancer ends. That's our motto. That's what drives us every day here at Moffitt. We're, of course, next slide, please, Leandro. We're, of course, based in Tampa, and we have, over the last few years, really expanded our footprint in the Tampa area. But we see patients from all over Florida, all over the US. We literally see patients from all 50 states. And we also have a growing source of patients from international markets, like most established and renowned institutes. So this is Moffitt in a nutshell. And if you want to go to the next slide, Leandro.
Yep.
Thank you. Yeah. And we are, as I mentioned, one of the top 3 oncology center in the country. That means a very large volume of patients. We have over 615,000 patient visits a year, 90,000 unique patients that are coming to Moffitt every year. We run anywhere between 700 and 800 clinical trials at any time at Moffitt. We initiate about 150 to 180 new clinical trials every year and enroll a lot of patients in these trials. And these clinical trials are very, very critical for Moffitt for many reasons. One is we see a lot of patients that are very advanced in their cancer journey. Usually they've been treated at other centers. They've gone through all the commercially available treatments, and they are relapsing and they need new options. So having clinical trials is really critical for these patients because that's usually the only hope they have left. We also are, what we want to believe, a preferred partner for the industry. So we're bringing, if you want, this ecosystem that Moffitt has put together over the years to the industry to come and test and, of course, prove that their therapies are not only safe, but also efficacious. And then we're building, if you want, these clinical trials as part of our entire ecosystem where we do research, collaborative research for some of these trials. We can also manufacture, in particular, on the cell therapy side. So this is the third benefit, if you want, that cuts both ways for the industry partners and for us. But ultimately, all this is serving our patients in a way that otherwise we could not serve them. And this is probably also, next slide, please, Leandro. This is also why we see much better outcomes for our patients. Not only do we have this patient-centric organization at Moffitt, we put the patient at the center of all our different departments. It's not, the patient moving from one department to the next. It's the departments moving to the patients at Moffitt. That's how we're structured. And this ecosystem, these clinical trials, the passion we have, the 40 years of experience really drive significant differentiated outcomes for these patients. up to 4 times the national average. And that's one of the reasons also why we see so many patients coming from different parts of the country. So this is at a high level who Moffitt is. One part that is little or less known about Moffitt is that we drive a significant research effort as well. We have about 1,600 people doing research and development on a day-to-day basis here at Moffitt. One area in particular that we've developed deep expertise is cell therapy. I'm just focusing on this one. You'll hear from my team that we have other areas where we have some of the top faculty members in the world. But cell therapy, next slide, Leandro, is really an area where we started investing many, many years ago. About 20 years ago, we had Dr. Jim Muley join Moffitt. Jim was working at NCI with Dr. Steve Rosenberg and created the beginning of a very long and successful story of Moffitt in cell therapy, having worked with pretty much all the leaders in the space, having participated and contributed to most of the therapies that are currently available on the market, the 5 CAR-Ts, and also more recently the TIL therapy approved just last year from Iovance. And in doing so, we've gone beyond just the clinical trials. We have a lot of research activities in the space of immuno-oncology in general and cell therapy in particular. We have our own programs now that we're moving through the clinic. You'll hear a little bit about that from Jenn Bonilla. We have two programs right now in phase 1. And we have also, because we are patient-centric, we've also structured ourselves in a way that really equip us very well to deliver these therapies. These therapies, as we all know, are still coming with a lot of patient management aspects. We need to stratify and select the patients very carefully. The patients go through these therapies and experience a lot of potential side effects, CRS in particular. And so we had to structure, if you want, our departments to deliver these therapies in a very particular way. We call that the IST platform at Moffitt. It has attracted a lot of interest from other institutions that are in the process of providing these therapies to their patients. A lot of interest also from industry, and all that culminating in us deciding to create a new venture, in fact, about 6 months ago, a company that we call Pagona Health. That's next slide, Leandro. And that's a company that's now in the business of helping other institutions get ready to and equipped to deliver this cell therapy that are transformative for patients, but are still coming with a lot of challenges, and so you need and want to be fully equipped to give it justice. And I'm just using that this company that we created as one example of the entrepreneurial and innovative mindset that prevails at Moffitt. And that's where I leave it and hand it over to Leandro. But women business, we have an history of partnering with the industry, an history also of generating IP, and we are growing into driving these IP assets through the development cycles and financing them to further de-risk them and advance them to patients. So I think this is my last slide, Leandro. I may have one more.
The last one is the one, the introduction to Sparrows, okay. But I can cover that.
Yeah, please go ahead. Thank you again for your attention.
So thank you very much. I'm going to talk mainly about one of Moffitt's initiative, which is the Sparrows campus. Sparrows is a 775 acres global science and technology campus focused primarily on cell therapy and advanced radiotherapy. We have already invested about $600 million in collaboration with the state and local governments in terms of land development and buildings. And that is part of what is estimated to be a $1.6 billion in the next 5 years. From a research point of view, we are focused on digital health and two main therapeutic modalities, cell therapy and advanced radiotherapy. I'll do a brief introduction. I'm the vice president for venture and investments. My background is in startups. As part of Synergiva, I raised $84 million in 8 different funding series, led 4 preclinical programs, one of them approved today, Kanuma, co-led the operations of Synergiva, leading to an IPO and subsequent $8.4 billion acquisition by Alexion. In the last 10 years, working primarily in hospitals and research institutes, accelerating assets, primarily gene and cell therapy, and then commercializing them. At Moffitt, as I mentioned before, I'm involved with the biotech cluster that comprises a new CDMO facility and an incubator and accelerator. This incubator accelerator has 2 main verticals. The first one, therapeutics and digital health, and Jenn and Kamal will go in details about the opportunities and related to this incubator and accelerator. The vision of Speros is to create a integrated ecosystem around our core technologies. The first in the biotech cluster is one important element of the Speros initiative. The biotech cluster is divided in 2 different segments. The first one is a CDMO facility. We've already manufactured. We have one facility, a CTF, that is responsible for manufacturing cell therapies for 20 different clinical programs. It has the ability to manufacture from preclinical through phase 2. We want to expand that capability with the new CDMO so that we can offer manufacturing from preclinical through commercialization, therefore significantly reducing tech transfer and interruptions in the clinical process. The second element of the biotech cluster is our incubator and accelerator. As I mentioned, it will be divided in 2 different verticals. The first one, digital health, which Kamal will be addressing in the next few minutes. And the second one is therapeutics, primarily a focus on cell therapy. Our history in cell therapy is very rich. We play a major pivotal role in the development of cell therapy over the last 20 years. We led in many aspects of this. First, clinical trials on CAR. We were the main contributor in terms of development of the recently approved TIL therapies, and we currently support 55 different clinical programs, of which, as I mentioned before, we manufacture cells for 20 of them. We have a world-class team of researchers and KOLs. We're in the forefront of advancing patient outcomes through our technology platforms. And I'll draw attention to something that Xavier mentioned earlier, which is the ICE-T. Pagona is the company that we spun off recently that is focused primarily on improving the patient outcome for patients going through cell therapy. Finally, in the last few years, we've established a number of partnership and alliances with main technology, with main biopharma around cell therapies, and that further strengthened our position in shaping the future of cell therapy. As also finally, as Xavier mentioned earlier, the objective of this presentation, this webinar, is rebranding our image and looking for potential new partners in this new initiatives that we have, both at Sparrows, in terms of digital health and cell therapy. And I'm pass the baton to Jenn to talk about the therapeutic assets that we have available and in general terms of our our strategy is. Thank you very much for the opportunity.
Hi, I'm Jenn Bonilla. Nice to meet you over this Zoom. I've been at Moffitt for a little bit under a year after many years in biopharma clinical diagnostics, such as at Merck and Genentech and Gilead and other places. So it's a tremendous opportunity for me now to be on this side in a comprehensive cancer center and understanding phase, how we could productively advance innovation that happens here after so many years of doing it in pharmaceutical companies. Really, the reason why we're doing this is we are a not-for-profit cancer institution, and we are looking to diversify our funding sources. So this group is one that will for sure understand how reimbursement may not be keeping pace with the costs of delivering care. And so for Moffitt, it's a real opportunity when you look at a tremendous amount of research that happens here, as well as direct patient care, the opportunity to advance innovations to potentially commercially available products and services, such as to companies that you represent. We could, in fact, unlock quite a bit of value here for Moffitt, which would allow us to continue to invest in the research. Moffitt is a NCI designated comprehensive cancer center. It sees over 90,000 patients, many of which receiving CAR T therapies, and has many different fascinating and pretty unique major research areas, including an integrated mathematical oncology group that does some pretty advanced work around adaptive therapy. You'll hear how that could also translate into some very cool drug development opportunities, but also patient care opportunities. So what we're looking for is, of course, alliances and partners and folks in companies that want to bring their programs and partner them within Moffitt with our tremendous faculty. So there's a brain trust here, but also the opportunity, whether it's through clinical development or otherwise, to advance your innovations and potentially create new ones together. And then as we go further, we'll say this towards the end of the call, a little bit about how we might structure create something here at Moffitt, a for-profit sort of structure that would allow us to take external capital. And then that could be very interesting for your venture arms or otherwise to participate in a different way in how Moffitt may monetize these tremendous innovations and allow patients outside of Moffitt to potentially realize those terrific outcomes you saw on the previous slide, 4 times the national average. There's some really special things that happen here at Moffitt for cancer patients. We'd like to see more patients benefit from that. So let's go forward a couple of slides here. Next slide. This group is very familiar with what's happened around immuno-oncology, and Moffitt has been a key player as well in immuno-oncology. We also know that some of that is hitting a little bit of headwinds in terms of the investment trends. But what's hot, and you've probably seen the same slide I have from the Boston area, from Atlas. But I really like the way they summarize what we've all seen in the investment trends. Some of the headwinds related to cell therapy and what we're doing at Pagona Health, as described by Xavier, to help unlock that because of the distribution complexity. So we're participating in trying to unlock that. But also we have some tailwinds. And what I wanted to point out when it comes to whether it's PROTACs, T-cell engagers, non-viral delivery, or targeted therapies, specifically radiotherapies, Moffitt is in the game on all of those. And we are advancing our own internal innovations and working with others. So I'm very excited about that Moffitt is skating to where the puck is going. Let's go to the next slide. The next slide just highlights, we'll skip this idea. This group knows what the funding trends are. Let's go to the next one. This one's pretty cool because most people wouldn't know this unless you spend a lot of time on the NIH reporter. You would know that we have about 800 million-ish, a little bit more than that, in open active grants from the NIH alone. And when you categorize that by the areas of investment, we are advancing important research, not just to advance our understanding of cancer. It's not just science projects here. There really are some very interesting opportunities here when it comes to developing compelling products and services that could be commercialized from the perspective of a pharmaceutical company or such. Let's go to the next slide. And some of those are listed here. So we have, and this represents a diversity of Moffitt therapeutics, a gamma delta project in phase 1 for prostate, tumor infiltrating lymphocytes, lymph depletion alternatives. So we have some therapeutics, some diagnostics, some life science tools and platforms that are we're starting to incubate right now. And I'll let Kamal say more about our digital ventures. But even on a risk-adjusted basis and without specifically putting a lot of what we would typically have in industry intense product development effort against it, there's real value here to unlock. And so that's what we're doing now, is starting to bring that what would be considered industry practices in terms of cross-functional core teams and leadership to really advance things correctly for competitiveness and regulatory success. And that's what we're starting to bring to our highest value opportunities today. And again, where we're going to really, I hope, develop things that industry will be very excited to participate with us. Let's go to the next slide. And that goes now to Kamal, hand off for digital ventures. Thank you.
Thank you so much, Jen. Very exciting the way you presented our portfolio. So thank you for that. Hello, everyone. Very nice to be here. Very excited to be here, mainly because I also have a dual status. I still live in Boston. I spent 15 years of my life working at Mass General Brigham, as many of you might be aware. And now I spend a lot of my time in Tampa, thankfully in 60-degree weather versus 13-degree weather. So I'm excited and speaking to you all from Tampa today. So my role at Moffitt is VP of Digital Ventures. What I really do is I figure out how do I take all the interesting things we're doing in the AI and digital space, and how do we create the best commercial opportunity for some of those ideas and assets, and then how do we get it in the hands of patients as fast as we can. So that's really our role. Next slide, Leandro. So this is sort of the 3 things that my team is focused on. The first one is inside out incubation, where we take ideas and intellectual property in the digital and AI space. We give it, we incubate it in a studio, and we give it its best chance of success commercially. We also do outside in partnership, where we bring in industry leaders in their own rights, big companies that are working on digital and AI technologies that would be beneficial to Moffitt and would allow us to co-create with them and also distribute our IP on their platforms. So we work on a lot of these kinds of partnerships. And the third one, we really believe that innovation, especially in digital, is not a solo sport. We want to bring the entire ecosystem together because different parts of the ecosystem add value, and we can sort of innovate together and bring some of these innovations to life faster if we work together. And so for that, we have an ecosystem development team that works on bringing the ecosystem together. I'll talk a little bit about our flagship program in that called CancerX, where we have 188 oncology organizations involved in our ecosystem. And I would love to invite people on this call as well to join us if it's relevant. So I'll talk a little bit about a few of the incubations and assets that we're working on. Next slide, please, Leandro. But the one thing I wanted to just sort of lay out is how we kind of think about this. So we have created an organized approach to take ideas from the kernel within someone's head or some research that someone might have done or a clinical trial that someone might have run, all the way to something that people have worked on for 10 plus years. To take that and then sort of take it all the way to a scaled company requires a systematic approach. And we're really proud of creating an organization where we work on these in a very systematic way, where we take a studio approach to early stage ideas, we support them, we resource them appropriately, we nurture those ideas, get it to its first 3 or 4 customers, get it to product market fit. Then we sort of, incubate and then accelerate them through our ecosystem. So this sort of stepwise approach allows us to give our ideas the best shot at success and get them to a scaled company. I wanted to share a couple cool things we're working on. So the next slide, Leandro, please. This is our vision for what we're calling the Netflix platform. It's the code name right now. But the idea here is that we want to take the know-how and the brain and the heart that Moffitt has and basically make that available globally. So as you can imagine, as a cancer center, our differentiator is not the building, it's not the rooms, it's not just, you know, the facilities that we have. Our real differentiator is in the know-how around the clinical care and how we cure cancer with our patients. What we want to do is we want to take that intelligence and in a dematerialized way, sort of bring this to the globe. So we have a vision where we're going to start to create a partnerships vehicle or a new platform that's going to be able to systematically bring a lot of these different assets, intellectual assets, to the world on a platform. We're starting with virtual second opinions where people from across the globe can come to Moffitt for a virtual second opinion without moving from where they are. And in a very quickly, time-sensitive way, we were able to give them world-class sort of medical guidance in a way that probably wasn't available to them before. Growing from that, we are thinking about doing a lot of other things that make us different to our clinical care pathways, because we do work in a lot of advanced cancers, and we have pathways and we have modalities that a lot of other organizations don't. Virtual tumor boards, collaboratively bringing some of these teams together, providing navigation and cancer care support to patients, and then eventually really building up towards this vision of what we're calling clinic of the future. All these different things, we can bring it in a center of excellence model and bring it to other oncology organizations as well as non-oncology organizations to be able to sort of see cancer patients and treat them with the Moffitt method in a way. So we're really democratizing the science and the excellence that we have at Moffitt and making it available to patients across the world. This is one idea that we're working on. It's going to be a spin-off, and it's something that we're bringing to the market with a first piece focus on second opinion. A second example that I want to give you, if you go to the next slide, Leandro, is this idea of using mathematical modeling. So we have an integrated mathematical oncology department at Moffitt. We're unique in having that. And by creating very unique mathematical models around how patients consume the medications and how we want to start and stop the dosages and how we want to tailor the dosages based on their specific disease condition and drug, we have been able to create a lot of intelligence around how we do that and are able to create really good outcomes in terms of time to cancer progression and overall survival. So this is an example of using the IMO modality in patients with prostate cancer. And what we were able to show was that we were able to reduce the expense per patient by almost $70,000 a year, but at the same time increase survival, right? Almost double survival by using actually less medication, by using a mathematical approach to how we deliver drugs to these patients. So this is an example of how we're using really different mathematical/AI approaches to changing how treatment can be provided to patients. And this is an asset that we're right now in the process of developing a company around as well. And then I would like to end with, if you go to the next slide, Leandro, with a quick shout out to our program CancerX. So CancerX is a public-private partnership between ONC, ASTP, as well as Moffitt Cancer Center. And as I said, we have 188 organizations working with us on a cross-industry ecosystem. And our goal is to reduce death by 50% by 2047, as well as really drastically improve the patient experience. We run an accelerator program, and we are just about to launch it in the next 2 weeks. We have a lot of organizations, really big organizations, accelerating startup companies. And the magic behind this is really that we're able to bring these organizations to bear for pilots, for commercial contracts, and really give these startup companies a meaningful platform to scale the kind of innovations that they're bringing to bear. This year, we had over 100 applications. We have finalized about 14 companies. And I'll just give you a couple stories that are my favorite. So last year, with our accelerator program, we had a company that came to Moffitt. Today, Moffitt has, as soon as a patient is referred to Moffitt, it takes us about 4 weeks to see the patient. And it is not because our physicians, not only because our physicians are busy, but also because it takes us 3 weeks to collect all their data, because they've usually been to 3 or 4 hospitals before they come to us. It's 1,000 pages of records that we collect. And it takes us a week to summarize all that for our attending to spend 4 hours with the patient and explain to them what's going on. So it's a 4-week wait. And for patients with cancers or recurrences, 4 weeks means a lot, right? It's every day really counts. We were able to bring an innovation through the accelerator last year that cuts this down to a 2 to 3 day period, from 4 weeks to 3 days. Now, with a technology like that, we need less people to do all the collation and the summarization. We are able to bring in patients faster, and we're able to sort of maybe potentially act on their tumors and cancers way faster than we were able to before. And so this reduces cost, but it drastically improves patient experience. It really does impact patient survival, and overall really good for the system, because we're really making this much more efficient. And that's an example where our organization looked at that and said, wow, this is a groundbreaking thing, even though it's a very simple application of artificial intelligence. So these are the kinds of things we'd love to accelerate, and we have huge other organizations like MSK, Dana-Farber, Elevance, Johnson & Johnson that are working with us on similar pilots and accelerating these companies in a meaningful way. So would love to see if you guys would like to join CancerX as well. That's all from me. Thank you.
Thank you, Kamal. Thank you, team. I don't know, Slava, you want to manage the remaining time? I mean, we certainly have the opportunity to answer a few questions.
Terrific.
But before we get there, I just wanted to emphasize the fact that we're probably not a traditional non-profit academic center. The people you see here on this panel from Moffitt are all industry veterans and experts. And so we are really bringing this for-profit mindset and entrepreneurial spirit to an outstanding organization that's doing fantastic work, but had maybe yet to fully translate that into opportunities, commercial opportunities. I'm not afraid to use the word commercial opportunities. Yeah.
Xavier, thank you. Go ahead, please.
Slava and Xavier and Kamal, I have a question. One, do you treat patients as outpatient, or do you actually admit them into the center and treat them on a long-term basis? And the second part of the question is, you are delivering service, and also on top of that, some research and advanced thing. Is there any way you can negotiate special rates with the insurance company that you are not like any other hospital, which is just delivering service, but you have added value on top of the service, and can you negotiate special rates?
I can.
Kamal, why don't you take this one?
Yeah, I can take that. Yeah. So the answer to your first question, yes, both. We do outpatient and patient both. So that's we're a full service center that way, with a comprehensive cancer center. To your second question, absolutely. We actually have ongoing conversations right now with payers like Cigna, where we're saying, you know what? We're following guidelines that are not NCCN guidelines, and they're probably more advanced than that. And we see patients that are really unique and really complex, but we have proof of better outcomes. And so, payer, you should work with us on these guidelines so that we can start to formalize these more and actually give you better outcomes elsewhere as well. Because this is not about keeping it as a huge secret. And Cigna, as an example, is very, very interested in that. And they're saying, you know what? We'll make it easier for you guys on the prior auth side if you can work with us on the data so that we can actually make this available to other people as well. Because it's beneficial to everyone if we do it in a concerted way. So the answer to your question is, yes, we see a lot of interest. We're yet to do something super big with them, but I think we're close.
Is there anything which you can do legislatively through Congress where you can basically tell the insurance companies that there is a lot more value in your service than simple, hospital which is delivering the service?
Yeah, I don't know if we would necessarily take a legislative approach, Mohan, on something like that. I mean, if we do our homework and demonstrate the value to patients and to the payers and the entire ecosystem, we want to believe that people will adopt these kind of new novel approaches rather than trying to enforce that through a legislative process.
Okay, thank you.
Xavier, thank you for the terrific presentation. I had quite a few people actually asking me for a recording afterwards, and they shared a few questions that I might ask on their behalf, so to speak. But please, for those on the call, unmute yourself, jump in, ask the question. We're an informal group, so we'd love to hear from you. So unless I hear somebody else, I'll just ask a few questions on behalf of those who could make it today. One, Lee, if you don't mind, there was a slide you shared with your timeline and the previous collaborations that you've had. Turnstone, of course, was one of the companies on the slide, and I'm very familiar with the company, so I'm familiar with that collaboration. My question to whomever is appropriate is, can you share some of the maybe lesson learned from those collaborations, maybe some positives and sort of good experiences, and something that would inform and advise prospective partners and collaborations who would be interested to partner with Moffitt. What was learned? What would you like the companies to know?
I can take a stab at this. As you know, this is remains a very a challenging area, drug development, with perhaps 90% attrition rate. What we are the message and what we are sharing here is that we have over the years created a pipeline that ensures success in a middle to long range. So if it is a process that has a significant attrition rate, we also bring, as you saw with Jenn and Kamal, a robust pipeline that will ensure success over time on this. Xavier, do you want to chime in?
Yeah, maybe I would add, Slava, that we have a lot of partnerships with industry, as I mentioned earlier, many clinical trials in particular. But what we've already seen is the benefit and the power of what we call the Moffitt ecosystem for our partners. A lot of times we get partners who come to us with a program that requires some correlative studies, for example, to help refine maybe a clinical trial endpoint. They may need some quality control support on their product. And so what we're trying to do is do more and more what we call alliance partnerships with the industry. And instead of having one-offs agreements where we do an agreement for a clinical trial, another agreement maybe here and there for some research activities, we are creating an alliance model very similar to what we are all familiar with in the industry. That's how the industry works with other industry partners. So we're emulating, if you want, this model where we enter into an alliance. It's a light framework. It provides some governance and some visibility and predictability, and set also expectations around deliverables and resources and budget and timelines. And then we execute, if you want, collaboratively under this umbrella alliance framework. And that's a lot more efficient and satisfactory for the industry partners because they have a lot more visibility and predictability. It's also easier for us, in fact, to deliver at our best, because when we are under this alliance model, we can first we prioritize, but we can also more effectively plan, and planning is a big part of the success. So that's some of the learnings that we've had in the past, and we're moving more and more toward this alliance model with our industry partners. You're on mute, Slava.
Thank you, Xavier. It also is aligned with the focus, with the feedback that I've received from some of your other partners. So thank you. Mark, do you want to ask your question, or you want me to read it off?
No, I can ask the question as well. It was mainly around autologous versus allogeneic therapies. And do you see a path forward for autologous therapies given the challenges that there are with scaling and the cost associated with autologous versus allogeneic?
I'll take a stab at this one, and Leandro, please chime in as you see fit. I mean, right now, obviously, all the available or commercially available approved, I would say, therapies are autologous. There are several allogenic programs under development. We have both at Moffitt. There is certainly a lot of benefits in the allogenic model. I would say probably even more so when we're going to see these therapies go into autoimmune diseases, where the market is even bigger, and we'll need to probably be a little more creative on the model. But even on the autologous side, there are a lot of efforts being done to standardize, reduce the cost of manufacturing in particular, simplify the episode of care, what I call the episode of care, which is from selecting the patient to releasing the patient in a way. And so we're just at the beginning of these therapies. I mean, the first one were approved just about 5 years ago. And there is tremendous innovation taking place. And so autologous will continue to have a very important role in select diseases and in treating patients, but allogenic will probably become also more and more front and center, in particular as we get into non-oncology applications.
Yeah. If I could add one element to that is as part of our going out and seeking new partnerships and alliances, one important aspect of this is the technology and how we'll do this in the future. So we are in discussions with companies that are involved in different aspects of automation of the manufacturing process. And so we believe that through that approach, a larger scale and reduction in costs will result from that particular approach.
All right, thank you.
Mark, you good?
I'm good.
Yeah, this is actually a very interesting point. I didn't realize that Moffitt is involved with the allogenics side of the cell therapy. So thank you for clarifying. Unless anybody else have a question, I had another 2 quick follow-ups. So one is probably to Jenn. Jenn, you mentioned the recent, for lack of a better word, financial environment, investment environment for the cell therapy. And considering the role of Moffitt and the power of what Xavier, you mentioned, there's the ecosphere and the environment, is Moffitt involved in advocating, promoting legislatively or otherwise? Is there anything Moffitt can do to help the cause with the cell therapy investment environment?
One of the ways we help is what was described earlier with Pagona Health, with this launch of trying to, again, offer and, make available for other centers almost a kind of turnkey solution for how they could also offer cell therapy. Because Moffitt has such an extensive history in developing even the processes, I mean, not just to create a cell therapy manufacturer, I mean to deliver it to the patient, right? To do that in a way that's safe and that is also efficient for the hospital. And that extends not just to the delivery, but also the acquisition of reimbursement for those therapies. This is not trivial, and it's not quite the same as other technologies that hospitals deploy. And this is what's held many community centers, frankly, from offering cell therapy, and why patients who may be great candidates do not receive cell therapy, because it would be a very long trip for them and it would require many weeks away from their home to be able to stay at a place like Moffitt to receive the therapy. So what we want to do is make it available and possible for more hospitals to deliver this kind of incredible service. I think this is how we're going to help Kite and others who are bringing cell therapies to market. And of course, they're doing their part in your usual way through medical affairs activities and otherwise. But we have an opportunity, not being the pharmaceutical company, not being the purveyor of the cell therapy ourselves, to offer services and solutions to these hospitals. And I think this could meaningfully differ. That could meaningfully unlock perhaps investors who are concerned that that might have hit kind of that ceiling of what you can do with the authorized treatment centers today.
Right. So the turnkey solution for Moffitt. That's
Bring them on
terrific.
more authorized treatment centers, right? And offer and
Yeah.
make it more possible. You could expand the market. The patients are there. There's no doubt that
Yeah.
there's patients there.
Yeah. No, this is terrific. Thank you. Again, unless anybody have a question, I have a question for Kamal. You and I spoke on Zoom recently about that, but maybe for the benefit of the rest of our crew, specific to the to the digital health, are there partnership opportunities, clients, companies that you would be looking for, or maybe that you can describe as the sort of digital health service that you can offer? Maybe make it broader, you know, other than just oncology, cell therapy. Is there anything specific in digital health that you would love to see partnership come across, companies approaching you for as a request for service or for help?
Yeah, lots of different ways to connect, right? So the first one I would say is we're open to partnerships with people who are leaders in their own fields in the AI and digital space. So as an example, we have a huge ambition in using AI to drive better clinical outcomes. We have a huge ambition in creating the clinic of the future, moving the locus of care to the home. There's a lot of different things that we're focused on from a care delivery standpoint, bending our cost curve, making our delivery more efficient. There's a lot of those things that if there's companies that are interested or have solutions in that, we're happy to collaborate. On the other side of it, we are coming up with new companies and new ventures in the space, right, where we can offer services. So for example, setting up cell therapy for people is one, but like also thinking about, you know, can we work on clinical pathways and guidelines or tumor boards? Can we you know, help patients with getting better AI-enabled therapies, even almost like as a therapeutic? And can we enable other people to use that? Can we enable better clinical trials? Can we help accelerate, you know, the path to clinical trials? Can we collect better data from patients? There's a lot of things that we're working on from our side that we would love to work with people on, even as they could become customers of some of our solutions.
Mm-hmm. I would add one element to that is the addition of different indications on these technologies. We've had a number of inquiries about the use of cell therapy for autoimmune. And so this is another area, another path that we're exploring, the application of cell therapies for extending the oncology indications to autoimmune. So those are opportunities that we are investigating now.
Terrific. This might be a good time for us to pause. One thing I want to mention for our Boston colleagues, Moffitt has one of the best conferences, the annual conference that is about to come up in a few months, the Business of Biotech on April 11th. I posted a registration link to the chat if you're interested to look at it. I've attended it last year. I'm definitely very much looking forward to attending this year. I swear it's one of the better conferences that I've attended in Florida. So I hope to see a lot of my Boston colleagues attend this as well. So on behalf of the ABFO Boston chapter, let me say thank you. Xavier, Jenn, Leo, Kamal, thank you very much, guys, for taking your time and sharing the Moffitt story. And just as a recent emigre from Boston to Florida, I'm very excited about building the bridges and connection between our two great states. So I hope something will come out from this conference, from this call, and possibly additional collaborations and follow-ups that we'll have as a result. So thank you. Appreciate it.
Thanks.
Thank you for the opportunity.
Thank you.
Good day.